Question number 1. A 7-year-old child was diagnosed with urinary tract infection. On assessment, his blood pressure 99 by 55 mm of Hg, temperature 36.4 degrees Celsius. Which of the following is the best appropriate nursing action? Options. Option A. Notify the physician immediately. B. Notify the nurse manager immediately. C. Document the findings in the nurse note. D. Put the patient in Tendelberg position. So here the correct answer is option C. Document the findings in the nurse note. The most appropriate initial nursing action, if the vital signs were significantly abnormal or the child exhibited signs of distress, we have to notify the physician, might be necessary. However, in this case, the documentation is the immediate action and ongoing assessment of care can follow based on the documented information. Question number 2. A nurse is caring for a 58-year-old patient with acute renal failure. In laboratory investigation, patient magnesium level is 2.8 millimoles per liter. Which ACG change is the nurse expected to note? Options. Option A. Prolonged QRX. B. Multiple P waves. C. Prominent U waves. D. Depressed ST segment. So here the correct answer is option C. Prominent U waves. The elevated magnesium levels can be lead to changes in the ECG, that is including the appearance of prominent U waves. So these U waves can be seen following the T waves and may give the appearance of a prolonged QT interval, so which can predispose the patient to arrhythmias. So while the prolonged QRX, multiple P waves and depressed ST segments can be associated with other electrolytes imbalances or the cardiac conditions. So they are not typically associated with elevated magnesium levels. Question number 3. A 23-year-old patient was admitted to evaluate pyrexia of unknown origin. According to her mother, her fever spiked 3.8 degrees Celsius every night to until morning for the last 2 weeks. The patient was quiet and interested in her surroundings, had language barrier, and her personal hygiene was not maintained. At lunchtime, she refused to eat the hospital food, but her mother yelled at her in front of others and forced her to eat. What basic need of the patient is disturbed according to Maslow hierarchy? Options. Option A. Self-esteem. B. Self-actualization. C. Safety and security. D. Food, water and shelter. So here the correct answer is option A. Self-esteem. Particularly the incidents where the patient mother was yelled at her and forced to eat in front of others. So this aligns with the extreme needs in the patient, the Maslow's hierarchy. So which includes the feelings of respected, valued and having a sense of self-worth. Question number 4. What is the most common clinical explanation of G6PD following the injection of aspirin? Options. Option A. Kidney failure. B. Acute hemolytic anemia. C. Hemophilia A. D. Thalassemia. So here the correct answer is option B. Acute hemolytic anemia. So glucose 6-phosphate dehydrogenase deficiency results in acute hemolytic anemia following the injection of a certain medication, that is including aspirin. So aspirin can trigger oxidative stress in red blood cells, so that is leading to the destruction in individuals with G6PD deficiency. So this results in the characteristic symptoms of acute hemolytic anemia such as fatigue, jaundice and dark urine. Question number 5. In managing a patient with hyperemesis gravidarum, the nurse must prioritize several interventions. Which of the following actions should be the primary focus to effectively address the patient's condition and prevent further complications? Options. Option A. Encouraging frequent small meals. B. Administering antiemetics as prescribed. C. Providing high protein snacks. D. Promoting rest and relaxation techniques. So here the correct answer is option B. Administering antiemetics as prescribed. So in hyperemesis gravidarum requires medical management to control the nausea and vomiting. So antiemetics are primary intervention. Question number 6. Which correct instruction to be followed in a discharge staging of a patient following a spinal fusion? Options. Option A. Do not use the stairs. B. Did not bend at the waist. C. Do not walk for long hours. D. Swimming should be avoided. So here the correct answer is option B. Did not bend at the waist. Following spinal fusion surgery, it's crucial to instruct the patient not to bend at the waist to avoid putting strain on the surgical site and potentially disrupting the healing process. So bending at the waist can increase the risk of complications such as dislodging or damaging the fusion. Question number 7. While evaluating a child in the emergency department, the nurse notices that despite feeling warm to touch, the patient has bluish nail buds and bluish lips. Which of the following should be the nurse immediately assess? Options. Option A. Respiration. B. Temperature. C. Pulse. And D. Blood pressure. So here the correct answer is option A. Respiration. Respiratory functions should be immediately assessed as it is crucial to determine if the child is experiencing respiratory distress or if there is any compromise in oxygenation. So prompt evaluation and interventions are essential in addressing the potential respiratory issues for the child. Question number 8. When caring for a client who has acute respiratory distress syndrome, a nurse elevates the head of the bed to 30 degrees. What is the reason for this intervention? Options. Option A. Reduce abdominal pressure on the diaphragm. B. Promote bronchodilation and effective airway clearance. C. Decrease pressure on medullary center, which stimulates breathing. D. Promote retraction of intercostal accessory muscles for respiration. So here the correct answer is option A. Reduce abdominal pressure on the diaphragm. So this positioning can improve the efficiency of breathing and ventilation, especially in patients with conditions like acute respiratory distress syndrome. So by reducing the abdominal pressure on the diaphragm, it allows for better expansion of the lungs and can contribute to improved respiratory function. Question number 9. During pregnancy, the uterus undergoes significant changes in size and weight to accommodate the growing fetus. By the time the pregnancy reaches full term, what is the typical weight of the uterus? Options. Option A. 500 grams, B. 1000 grams, C. 1800 grams and D. 2000 grams. So here the correct answer is option B. 1000 grams. So in the uterus, that is increase the weight from approximately 70 grams in the non-pregnant state to about 1000 to 1500 grams at the term, that is due to the growth of the fetus, placenta and amniotic fluid. Question number 10. An 11-month-old girl is brought to the emergency department with frequent diarrhea. Her mother responds that she passed loose stools 7 times since the morning. She seems to be thirsty and irritable. Physical examination revealed dry mucous membrane and poor skin turgor. Heart rate 150 beats per minute. Respiratory rate 35 breaths per minute. Temperature 37.1 degrees Celsius and weight 5 kg. Which of the following is a calculated amount of oral rehydration therapy? Options. Option A. 400 ml, B. 600 ml, C. 700 ml and D. 800 ml. So here the correct answer is option D. 800 ml. So based on the clinical presentation and the weight of the child, the calculated amount of oral rehydration therapy can be estimated using the following formula. Okay. So calculate the maintenance fluid requirements. For the first 10 kg body weight, that is 100 ml per kg per day. And for each addition kg over 10 kg, that is 50 ml per kg per day. And for an 11-month-old girl weighing 8 kg, that is 100 ml per kg per day. So we can able to calculate for 8 kg child, that is required 800 ml per day oral rehydration therapy is required.